Hello and good day, everyone. My name is Nur Adlina binti Zainal Abidin, and I am from the Master in Molecular Medicine ODL program from International Medical University. Today, I am going to present on the comprehensive review of breast cancer. Before that, I would like to introduce the contents that will be elaborated in this presentation, which consists of the above: the introduction and background study of breast cancer, genomic alterations that are most frequently found in the disease, and what signaling pathways that take parts in the progression of breast cancer. We will also talk about some epigenetics modifications that are known to be involved in the disease, as well as the methods that can be used for assessing the disease mechanism. Lastly, we will talk about targeted therapies available for breast cancer, as well as some that are in the development, including some literature reviews and references. Breast cancer is one of the most universally diagnosed cancer around the world, frequently more in the female gender in comparison to the male. The incidence rate reported in the female are 1 in 8 in comparison to the male, which is 1 in 1,000. According to Globacon in 2020, breast cancer has the second highest incidence rate in all of the cancer cases, with over 2 million of incidence report, making up around 11.7% of all cancer cases. It is also being recorded as the fourth highest contributor to mortality-related cancer, with over 600,000 cases. It was also found that the incidence report for breast cancer is higher by 88% in transition countries in comparison to developing countries, with Australia and New Zealand being the highest, followed by Western and Northern of Europe. However, the mortality rate for breast cancer in transition countries is lower in comparison to the transitioning countries like Asia and Africa. This can be explained that women from the transition countries have some access of some of the best healthcare treatments in the world in comparison to others from the transitioning countries, which consist of women from low or middle income families. The World Health Organization have suggested some of the risk factors known to contribute to the development of breast cancer, which firstly consists of the female sex. As female tends to produce high levels of hormones throughout their lifetime, like estrogen and progesterone, it makes them more vulnerable to the development of breast cancer. According to Globacon, age is also a risk factor, as most of the incidents being reported from around the world are from females that are of more than 50 years of age, indicating that chances of developing breast cancer increases as one advances in age. Family history, on the other hand, is one of the major risk factors in breast cancer, as inheritable germline mutations like BRCA1 and BRCA2 can be passed from a parent to an offspring in an autosomal dominant pattern. BRCA1 and BRCA2 contributes to at least 25% of hereditary breast cancer cases. Hormonal factors also play a role, as reproductive history or prolonged use of hormonal treatments may cause an imbalance to the hormone levels in the body, thus increasing the risk of getting breast cancer. It was also highlighted in the Globacon 2020 reports that most females who were diagnosed with breast cancer also have obesity and a high alcohol intake consumption, which both are known to be common risk factors in carcinogenesis. Breast carcinoma can arise from the ductal epithelium known as the invasive ductal carcinoma, or the lobules of the breast, which is known as the invasive lobular carcinoma. Invasive ductal carcinoma is known to be one of the most frequently diagnosed breast cancer cases, with over 80% of cases, while invasive lobular carcinoma makes up around 10% of all breast cancer cases. Breast carcinoma can also be further classified into four categories based on their molecular characterization, which are normal, luminal, HER2-enriched, and basal-like. The luminal subtype can further be broken down to luminal A and luminal B, which are known to be hormone receptor positive for estrogen and progesterone, or either one. HER2-enriched, on the other hand, are breast carcinoma tumor cells that overly express the human epidermal growth receptor 2, HER2. The basal-like subtype, however, lacks all expressions of estrogen, progesterone, and HER2, which results in aggressive tumor behaviors mostly seen in triple-negative breast cancer cases. Genomics is the study of DNA sequences in an organism. It helps in identifying the genetic alterations found in the development of a disease. In the study of breast cancer, there are a few genetic alterations known to be involved in the progression and development of breast tumor cells. Besides that, the European Society for Medical Oncology, ESMO, have also released clinical guidelines for the management of breast cancer, where genetic testing for these genes are crucial prior to treatment. Breast cancer type 1 and breast cancer type 2, known as BRCA1 and BRCA2, are known to be responsible for at least 25% of hereditary breast cancer cases. These genes are inheritable germline mutations with high penetrance, but can also be seen as somatic mutations in some cases of breast carcinoma. BRCA1 has the function of regulating the cell cycle by ensuring that any damaged DNA in the cells are repaired before proceeding to the next phase of the cell cycle, while BRCA2 functions as a recruiter of RAD51 protein, which is essential in the process of homologous recombination and contributes to the stabilization of the genome during repair of double-stranded breaks in the DNA. Mutations in these genes will lead to truncated or non-functional proteins, resulting in their inability to repair damaged DNA and instability of the genome, thus inducing breast cancer development. The tumor protein p53 is encoded by the gene TP53, which is involved in many various activities of the cell, such as the cell differentiation, cell death, and response to damaged DNA repair. It functions as a tumor suppressor gene that is well known for its anti-proliferative characteristics by binding to specific targeted genes that helps in promoting cell transcription, resulting in the cell cycle arrest and promoting cell death and repair of damaged DNA. This marks the protein as an important target for inhibition of carcinogenesis. Alterations of TP53 is responsible for highly likely around 35% of breast cancer cases, and most of these cases are associated with triple negative breast cancer. TP53 is commonly found altered in some form of point mutations, leading to the loss of function, which leads to uncontrollable cell proliferation. HER2 is a receptor tyrosine kinase known to be involved in cellular processes such as cell migration, cell survival, and differentiation, making it contribute to around 25% of breast cancer cases. Overexpression and amplification of the HER2 genes is often found in HER2-enriched subtype, and activation of this receptor is connected to other signaling pathways such as PI3K and MAPK signaling pathway, which are signaling pathways that are known to be highly associated with tumor and cancer development. The lipid kinase phosphatidylisotyl 3 kinase, or known as PI3K protein, consists of a regulatory subunit P85 and a catalytic subunit P110 alpha, which is encoded by the PIK3CA gene. Activation of this kinase leads to P110 alpha catalytic unit to phosphorylate phosphoinositide at the D3 position of the inositol ring, leading to activation of AKT protein in the PI3K signaling pathway, which is highly associated with the development of breast tumor cells. Alterations of the PIK3CA gene is frequently found at exon 9 and exon 20, which leads to a gain of function in the PI3K protein, resulting in hyperactivation of the PI3K-AKT-mTOR signaling pathway. When proteins interact with one another, it results in a signaling cascade, which is responsible for most of the biochemical reactions that occur in the body. In the development of breast tumor cells, these are the signaling pathways that are highly associated with its disease mechanism. From the diagram above, we can see that all four signaling pathways are highly connected to one another. In the ER signaling pathway, there are the nuclear receptors ER alpha and ER beta. ER alpha promotes receptors targeted gene expression through its interaction with the cyclin D, while ER beta suppresses this interaction, which inhibits uncontrollable cell proliferation. In hormone receptor positive breast cancer, it is found that overexpression of ER alpha and downregulation of ER beta in the ER signaling pathway is the cause of uncontrollable cell proliferation that drives the growth of breast tumor cells. In the HER2 signaling pathway, activation of tyrosine kinase receptor HER2 by phosphorylation of tyrosine residues in the intracellular domain leads to the activation of other signaling pathways like PI3K and MAPK signaling pathway. Hence, overexpression of HER2 can lead to promotion of tumorigenesis in the breast cells. The PI3K-AKT-mTOR and mitogen-activated protein kinase signaling pathway are well-established signaling pathways in the study of cancer. On the surface of the cells, there are several receptors such as tyrosine kinase receptors, serine threonine receptors, and G-couple receptors, which will transduce a signal into the cells, resulting in the recruitment of adapter proteins like PI3K and RAS protein, respectively. The PI3K protein, which will use its catalytic subunit P110 alpha to add in the phosphate group to phosphatidyl mesotyl 4,5 biphosphate known as PIP2 into activation form PIP3, which will then subsequently activate AKT protein, resulting in a signaling cascade of the PI3K signaling pathway. Similarly, in the RAS protein, which will activate the RAF protein, resulting in a MAPK signaling pathway cascade. Both signaling pathways carry out similar functions like protein synthesis, cell proliferation, and survival. However, the PTEN protein acts as a negative regulator for the PI3K signaling pathway. Hence, it was observed in breast tumor cells that loss of function in the PTEN protein and activated mutations in the PI3K protein will result in hyperactivation of the PI3K AKT mTOR signaling pathway, leading to carcinogenesis. Epigenetics is the study of heritable traits in the regulation of genetic cellular activity without any alterations being made to the DNA sequence. Two well-known mechanisms of epigenetics are DNA methylation and histone modification. In DNA methylation, the DNA methyltransferase adds in a methyl group to the DNA sequence at the fifth carbon of the cytosine ring, which forms a 5-methyl cytosine. This complex plays a vital role in regulating genetic expression and predominantly occurs at locations with high context of CpG dinucleotides, known as CpG islands. CpG islands are unmethylated promoter regions where genetic transcription occurs. Hence, methylation of this region is highly associated with gene silencing by inhibition of genetic transcription. Unlike in other cancers, in breast cancer, CpG hypomethylation occurs in the gene body region and not in the promoter region, which results in the activation of gene transcription and inducing cancer development in the breast. Another crucial feature of epigenetic modification that severely impacts the stability of the chromatin structure and gene regulation is histone modification, where disruption in this process can contribute to the progression and growth of cancer cells. In this process, histone acetyltransferase, known as HAT, adds in acetyl group to the lysine residues found on the histone, which neutralizes the charge of the lysine residues, resulting in the uncoiling of the DNA genome from the chromatin, which is seen in the diagram above, and promoting genetic transcription to occur. The histone deacetylase HDAC serves the opposite function, resulting in the DNA to coil around the histone structure, resulting in the chromatin. This shows that histone modification may influence the expressions of proteins in the cell, such as oncogenes and tumor suppressors. Hence, non-functional HDACs may lead to a reduction of tumor suppressors being expressed in the cells. Evidence have also highlighted that gene repression by the trimethylation of histone H3 on lysine 27 by EZH2 complex is highly associated with the progression of breast cancer, and it was later found out that overexpression of this complex is common in aggressive behaviors of tumor cells, resulting in uncontrollable cell proliferation. There are several methods that can be used to study genomic alterations found in the disease, and some of these methods have also been enhanced to be applied in the diagnostic field. According to the National Comprehensive Cancer Network, NCCN, it was heavily emphasized on the importance of biomarker testing prior to targeted treatments in breast cancer. This is to ensure that the patients receive the correct diagnosis before proceeding for any targeted treatments. A technique widely used to evaluate the hormonal status of patients diagnosed with breast cancer is immunohistochemistry, known as IHC, where it is a process of antigen binding to a specific and targeted antigen found on the tissue cells. It is cost-effective and a reliable technique for assessing estrogen, progesterone, and HER2 hormonal status. However, in the cases where HER2 status score results in an equivocal or borderline between positive and negative, FISH or fluorescence in situ hybridization is another superior method in assessing HER2 expression and amplification. This is done by fluorescence probes that binds with high complementary degree towards a specific targeted region of nucleic acid sequence, and especially helpful in predicting response towards HER2 target therapy. Another powerful technique that can provide comprehensive profiling of genes involved in the pathogenesis of a disease is next-generation sequencing, or NGS. NGS is able to provide and identify genomic alterations, gene fusions, copy number variations, MSI status, genomic instability score, and tumor mutational burden, hence making it very helpful in the diagnostic field and research field, which also includes high specificity and high sensitivity detection method. However, this technique is not very cost effective and tedious laboratory work is required in the library preparation and bioinformatic analysis due to the huge amount of data being acquired. Currently, there are NGS-based panels available that targets a specific subset of disease with important biomarker probes already readily available. In the case of breast carcinoma, there are panels like homologous recombination, HRR, homologous recombination deficiency, HRD, tumor mutational burden, TMB, and genomic instability score, GSS, which will provide a helpful insight on the treatment of breast cancer. In addition to that, there are also prognostic assays such as Prosigna, Oncotype DX, and MammaPrint, which uses genetic expressions of cells such as PAM50 in the tumor cells to assess the patient's risk of distant recurrence in breast cancer along with their molecular subtype, hence aiding in the decision-making for targeted therapy treatments of patients. Molecular medicine is an interdisciplinary field that combines the knowledge of genomics, proteomics, epigenetics, and metabolomics to understand and treat a disease at a molecular level. This basic principle of molecular medicine has served as a foundation for improvement of healthcare and advancing towards personalized medicine and the making of targeted therapy. There are several targeted therapies available for targeting specific genomic alterations found in breast tumor cells. For patients with hormonal receptor positive breast cancer, hormonal therapy or endocrine therapy is the most suggested treatment depending on the female's menopausal status. There are several drugs available for hormonal therapy and they have also been FDA approved mostly. Selective estrogen modulators such as tamoxifen are used with the aim to lower the level of estrogen hormones expression in the cells, thus reducing cell proliferation, while aromatase inhibitors inhibits the function of aromatase enzyme, which results in the reduction of estrogen production, and fulvestrant, which is a selective estrogen receptor degrader, that's exactly as the name indicates, which degrades the estrogen receptors found on the tumor cells and obstructing the ER signaling pathway. In HER2-targeted therapy, monoclonal antibodies such as trastuzumab and pertuzumab are commonly used in combination among patients diagnosed with breast cancer. Trastuzumab binds to the HER2 receptors and prevents activation of the HER2 signaling pathway, while pertuzumab enhances the effects of trastuzumab. Targeted chemotherapy against HER2-positive breast tumor cells can also be achieved through a combination of drugs between trastuzumab and a cytotoxic agent, namely adotrastuzumab emtansine, known as TDM1. PIK3CA, which is known to encode for the catalytic unit of P110 alpha of the adapter protein PI3K, which is involved in the activation of the PI3K signaling pathway. Alpelisib is a PI3K alpha specific inhibitor for those that harbor activating mutations in the PIK3CA gene in advanced or recurrent metastatic breast cancer cases. Its function is to inhibit the recruitment and phosphorylation of adapter proteins in the PI3K signaling pathway. For diagnosed breast cancer patients with BRCA1 and BRCA2 mutations, they will highly likely benefit from the use of PARP inhibitors such as olaparib, which aims to inhibit the enzyme poly-ADP ribose polymerase that takes part in the DNA damage response pathway and prevents uncontrollable cell proliferation. In recent years, there has been new research and development for the management of breast cancer, which leads to new emerging therapies. Some of these novel treatment options will be reviewed and are currently still under investigation. Immune checkpoint inhibitors such as pembrolizumab is a monoclonal antibody which targets the PD-1 and PD-L1 pathway by preventing the programmed DEath1 PD-1 interaction with its ligand PD-L1, thus enhancing the immune system to target cancer cells. Ongoing clinical trials data from KEYNOTE-522 and KEYNOTE-523 has shown promising data for pembrolizumab with positive progression-free survival rate outcomes among the patients diagnosed specifically in triple-negative breast cancer, which are known to harbor aggressive tumor behaviors. Cyclin-dependent kinase 4 and 6, on the other hand, are serine-threonine kinases that plays a crucial role in the cell cycle progression through their interaction with cyclin D. CDK4/6 inhibitors such as palbociclib, ribociclib, and abemaciclib inhibit the kinase activity of CDK4/6 through the prevention of their interaction with cyclin D, which results in the cycle cell arrest and obstructs uncontrollable cell proliferation. Data from Paloma 1 Trio 18 clinical trials suggested that CDK4/6 inhibitors were used in combination with hormonal therapies such as fulvestrant or letrozole, which showed promising outcomes among hormone receptor positive breast carcinoma subtypes. And lastly, epigenetic therapies such as HDAC and DNMT inhibitors are also under investigation in targeting the histone deacetylase and DNA methyltransferases to reverse any aberrant epigenetic modifications found in breast cancer cells due to the heterogeneous nature of the disease. It was later found that combination therapy between HDAC inhibitors with PD-1 and CTI4 blockage agents are shown to be effective, as it can increase tumor regression and program cell death in breast tumor cells. However, the use of epigenetic treatments in breast cancer patients are still undergoing several investigations in several clinical trials. It was also highlighted that toxicity and the side symptom of this treatment still remains unclear and requires more investigation. Here are some of the literature reviews on breast cancer that were used in this presentation and for further reading. I found that these literature reviews are mostly helpful in understanding more about the targeted treatments in breast cancer and also their molecular subtypes. That is all. We have reached the end of the presentation, and above are the references used for this presentation. Thank you all for your kind attention and have a good day. Here